Hello, hi, this is Dr. Erica Onigbola. Welcome to my channel. If you're new to my channel, please like, share, and subscribe. Please do. I would like to reach 1,000 subscribers within the next 2 months, 3 months. So that's my goal. And if you're not new to this channel, please just like and make a comment. Let me know that you're listening out there. Today is Martin Luther King holiday, and I want to just um, encourage and acknowledge the day because it stands for diversity and love and forgiveness and equality and unity amongst all people, whether it's in the United States or abroad, right in your neighborhood, at work, in the classroom. So we should always exercise equality and love for one another and respect for one another. And I just want to reiterate that on today because it is very important. And that's what the late Dr. Martin Luther King Jr. wanted for this nation and for the blacks and the whites, the Asians, the Indians, all people. And so I want to just reiterate that on my platform on today. So I hope everyone is enjoying their MLK Day and enjoying their family and friends and loved ones on today. Embrace and contact those who you might not have been in contact with, just to let them know that you love them and that today is a good day to reach out, and for that reason. So today's topic, besides it being Martin Luther King Jr. holiday, today's topic is vitamin D, as you can see in the title. I've gone over vitamin D before with the bisphosphonate therapy. That's the Fosamax, the Actonel, the Residuinate, also that class of medication are bisphosphonates, which are indicated for osteoarthritis and increasing bone mineral density. So vitamin D is taken along with the bisphosphonate therapy as well in order to ensure adequate bone resorption and bone deposits and things like that helps the bone grow and maintain a sturdy stability. That way the density does not decrease, and then that way bone fracture does not occur. So vitamin D is used with bisphosphonate therapy. And so because of that topic that I went over before, I didn't go over it very thoroughly or very in depth because I was talking more about the bisphosphonates. So vitamin D, there are active and inactive forms. The main source of vitamin D is going to be from UV sunlight and also from food sources, fortified foods, and again, your sunlight. So when you go out into the sun for just for exercise or for yard work, naturally vitamin D in the skin is going to be activated from UV sunlight, and that is a natural way for vitamin D to be incorporated into the body. Okay, and that is the inactive form. And then later on, vitamin D is converted to an active form by the liver and the kidneys. By the liver and the kidneys. So vitamin D is very important. Its metabolic pathway is very important. So it's good that we have good organ systems and that we receive good sunlight. If not, then we can get it from not sunlight, then our food sources. If not food sources, because food sources might not just be enough, we can get that from our supplementation, our dietary vitamin D supplementation, okay? All right, so the first vitamin D that I want to make mention is vitamin D3, which is cholecalciferol. Recommended 400 to 1,000 units per day or more due to low malabsorption or multiple anti, what did I write? Okay, if low malabsorption or consumption, so vitamin D3 is good for calcium, phosphorus. It's fat soluble, so it should be separated from other medications when taking, because we want to make sure that it gets absorbed properly in the GI tract and at its get it absorbed pharmacokinetically and is used, at its full potential. So vitamin D3 is called calciferol, and it's recommended 400 to 1,000 units per day, and that is its recommendation. Now, if you're counting your vitamin D daily value from your nutritional label, food label, just multiply the daily value in the percent times the number 4, and that will give you the units that you're going to receive from that particular serving. Okay, so again, you're going to take the percent daily value, multiply that times the number 4 to get the total number of units that you will get on that particular serving. Okay. Now, patients who are over the age of 50 years of age should receive 800 to 1,000 units of vitamin D. That's 800 to 1,000 units of vitamin D a day. Now, someone who's age 19 to age 49, it's recommended that vitamin D should be 400 to 800 units per day. 400 to 800 units taken per day. Okay. And then vitamin D2, which is ergocalciferol. Ergocalciferol is, again, food sources and comes from fortified food sources and also from the UV sunlight. And then supplementation is given based upon lab work and a doctor's findings and diagnosis. Okay, so vitamin D2 is 50,000 units. 50,000 units, yes, 50,000 units every week or twice a week from anywhere from baseline all the way up to 12 weeks. Again, that's 50,000 units from baseline all the way up to 12 weeks, just depending on the need and the baseline count at that particular time. Then the patient will go up from every week or twice a week to once a month, taking one capsule once a month. And that is for maintenance. That is for maintenance for someone who has received a diagnosis and should be actually taking the medication on a regular basis. That is when we want to incorporate maintenance therapy, and ergocalciferol is more for maintenance therapy. There are other forms of vitamin D, like the calcitrol or rocatrol, and I won't go over that in too much details, but it's given in capsule form as well, and it's given by mouth once a day, or it's also given IV. It's also given IV as well, okay? So the two main vitamin Ds I've gone over, and its benefits, increasing calcium, phosphorus, also for bone resorption and formation and sturdiness, for prevention of bone fracture in our elderly patients, hip fracture, vertebrae fracture, and all other non-vertebrae fractures in the body. So vitamin D helps to increase bone mineral density, which is what we want, and then also it helps with absorption of those other minerals in the GI tract. And again, vitamin D is fat soluble along with vitamin A, vitamin E, and vitamin K. Those are our fat soluble vitamins, and they can be taken with fatty meals or like bag of chips or greasy chips, or a greasy hamburger, which I don't normally recommend, but just keep in mind that vitamin D is fat soluble, and when taken with other medications, it can prevent other medications from being absorbed properly, and other medications can prevent vitamin D from being absorbed properly. So take your vitamin D separate from your other medications, and take with something maybe like a small bag of Lay's chips that has a little greasy to it. That way, the absorption is adequate. Okay. Also, to make mention that certain age groups require a certain amount of vitamin D per day. And also make sure that we know that daily value on our nutritional label times the number 4 gives us the total units that we're going to receive per serving, okay, in that day on the food label. So vitamin D3, vitamin D2, they are prescription. There are some vitamin D products that are over the counter that can be purchased at your local pharmacy without a prescription, without your doctor's recommendation. And also vitamin D is also incorporated into multivitamin supplements as well. So you're going to get some vitamin D in your multivitamin dietary supplement that you get over the counter. And it is age-based, so based on your age, you'll get a certain amount. It won't be equal across the marketing board. So just be aware of that as well. Multivitamins are essential and are good to be taken, and you'll get a unit, get some units of vitamin D. And before adding vitamin D to your vitamin therapy, do consult your healthcare provider, especially if you're already taking a multivitamin that has vitamin D in it. Of course, be sure to get the opinion of your doctor before you start an additional regimen of vitamin D, because they are sold separately from the multivitamin in the vitamin section. Okay. All right, and so that's what I want to go over on today. Prevention of fractures, stabilize and improve bone mass and strength, preventing fracture, reducing pain, improving function and capacity and quality of life. So vitamin D is good, a good supplement. It won't hurt to take extra, but just be aware that I'm, as a healthcare provider myself, a pharmacist for close to 10 years, I want to ensure that you are taking vitamin D cautiously. Any medications that you might decide you might want to take cautiously. So we know vitamin D is taken along with the bisphosphonate therapy. You can watch my bisphosphonate video about the Boniva, the Actonel, the Residronate, the Fosamax. All of those are good first-line therapy for bone mineral density and osteoporosis prevention, bone fracture prevention. And then we're going to see the vitamin D come along on board later on. So that's what I wanted to mention on today. And I thank you for joining me. If you have any questions or comments, please leave those in the comment section. And again, like, share, and subscribe if you are a new YouTuber to this channel. And I look forward to giving out more information and learning more about, or giving out more pertinent information that that I have to share with you. And thank you for joining me. And I look to hear from you uh, on the next video chat. Okay, thank you, and enjoy your MLK Day, and remember, peace.